LPN NCLEX Practice Questions 2020. Question 1. Set 1. What is the therapeutic level for lithium? 0.1 to 0.5 milliequivalent/L, 0.6 to 1.2 milliequivalent/L, 1.5 to 2.5 milliequivalent/L, 3.0 to 4.0 milliequivalent/L. The maintenance therapeutic range for lithium is 0.6 to 1.2 milliequivalent/L. Question 2. Set 2, which is a common side effect of radiation therapy to the head and neck? Diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 3. Set 3, a patient with type 1 diabetes is shaky and sweaty. What should the nurse do first? Administer insulin, check the blood glucose level, give 15 g of simple carbohydrates, notify the provider. Assessment of blood glucose is the first step when hypoglycemia is suspected. Question 4. Set 4, which is the correct order of the nursing process? Planning, assessment, diagnosis, implementation, evaluation. Assessment, diagnosis, planning, implementation, evaluation. Diagnosis, assessment, implementation, planning, evaluation. Evaluation, implementation, planning, diagnosis, assessment. ADPI assessment, diagnosis, planning, implementation, evaluation. Question 5. Set 5, a patient with COPD is receiving oxygen. Why should the nurse maintain the flow rate at 1 to 2 L/min? To prevent oxygen toxicity, to avoid suppressing the hypoxic drive, to prevent dry mucous membranes, to save cost. Patients with chronic hypercapnia rely on low oxygen levels to stimulate breathing. Question 6. Set 6, what are the 3 P's of diabetes mellitus? Pain, pallor, pulselessness. Polyuria, polydipsia, polyphagia. Poverty, pollution, population. Pressure, paresthesia, paralysis. Excessive urination, thirst, and hunger are classic signs of hyperglycemia. Question 7. Set 7, which medication is used to treat a suspected opioid overdose? Naloxone, flumazenol, atropine, epinephrine. Naloxone, Narcan, is an opioid antagonist. Question 8. Set 8, which type of immunity is gained after receiving a vaccine? Natural active, artificial active, natural passive, artificial passive. Artificial active immunity results from vaccination. Question 9. Set 9, a patient with DKA has small respirations. What is the physiological reason for this? To retain oxygen, to blow off CO2 and correct metabolic acidosis, to decrease blood pressure, to increase intracranial pressure. Small respirations are deep and rapid to compensate for acidosis by removing CO2. Question 10. Set 10, what does alopecia mean? Loss of appetite, loss of hair, loss of hearing, loss of skin pigmentation. Alopecia is the medical term for hair loss. Question 11. Set 11, what is the purpose of administering magnesium sulfate to a preeclamptic patient? To lower blood pressure, to prevent seizures, to induce labor, to increase fetal lung maturity. Magnesium sulfate is the drug of choice for seizure prophylaxis in preeclampsia/eclampsia. Question 12. Set 12, a patient with cirrhosis has an elevated ammonia level. Which medication should the nurse expect to administer? Lactulose, furosemide, spironolactone, propranolol. Lactulose promotes the excretion of ammonia through the stool. Question 13. Set 13, what is a major safety risk for toddlers? Sports injuries, poisoning and drowning, occupational hazards, elder abuse. Toddlers are at high risk for accidental poisoning and drowning due to their curiosity and mobility. Question 14. Set 14, what is the primary goal of care for a patient with Alzheimer's disease? Curing the disease, maintaining safety and function, improving memory, teaching new skills. Management focuses on safety, nutrition, and maintaining the highest level of function possible. Question 15. Set 15. A patient is receiving vancomycin. The nurse notes redness on the face and neck. What should the nurse do? Stop the infusion immediately, slow the infusion rate, administer epinephrine, document as a normal finding. Red man syndrome is often caused by rapid infusion of vancomycin. Slowing the rate usually resolves it. Question 16. Set 16. Which position is best for a patient receiving a tube feeding? Prone, supine, high Fowler's, left lateral. High Fowler's position prevents aspiration during enteral feeding. Question 17. Set 17. A patient is experiencing an acute manic episode. What is the priority? Involving them in group therapy, providing a high-calorie, finger food diet, teaching coping skills, encouraging social interaction. Manic patients have high energy and may not sit for meals. Finger foods provide necessary nutrition while on the move. Question 18. Set 18. At what age should a child be able to sit unsupported? 4 months, 6 months, 9 months, 12 months. Most infants can sit unsupported by 6 to 8 months. Question 19. Set 19. Which fetal heart rate pattern is most concerning? Early decelerations, late decelerations, accelerations, moderate variability. Late decelerations indicate uteroplacental insufficiency and are non-reassuring. Question 20. Set 20. Standard precautions apply to which of the following? Only patients with known infections. All patients regardless of diagnosis. Only patients in ICU. Only surgical patients. Standard precautions are used for all patients to prevent cross-contamination.